Good evening, everybody. We're going to give some time for everyone to settle in. Thank you for being here tonight, or this afternoon, or this morning, wherever you're joining us from. Hello, hello. Just give it a few more seconds. Get settled in. We're in for a great conversation today about wellness at Duke. So we want you to also be well. Find a settled place, a cozy little spot in your home, hopefully. Maybe you're listening on the go. We're just glad that you're here. All right, we're going to go ahead and get started. Hi, everyone. My name is Karina Carpenter. I'm the Associate Director for the Office of New Student and Family Programs here at Duke. We're so excited that you're joining us for our second parent and family webinar orientation series of 2024. And today we're talking about wellness at Duke. So we're going to talk about 4 different offices that provide support for your student during their time at Duke. And hopefully you walk away with some good resources and some good connection to understand how we prioritize wellness here at Duke. So a few housekeeping pieces before we move forward. The Q&A feature is going to be our friend today. So if you have any questions that pop up throughout the presentation, please feel free to type those in. We are going to do a mix of answering some questions, maybe via typing them, and then at the end of our presentation today, we're also going to have a Q&A section that will ask some questions live. So we asked for some of your questions. If you have a really specific question, maybe about your particular student or something really specific, we do want to make sure that we're following like HIPAA violations and all sorts of good things. So we might encourage you to email us or email the appropriate person, and we might not ask your question out loud. But we do want to make sure that we answer questions that lots of folks have. So don't be afraid to ask it, because someone else may be on the Zoom like, oh, I wish I would have known that. So feel free to submit those questions. The chat is disabled, so that is not the part that's not where you need to post your questions, but use the Q&A feature. And then just so we know, this webinar is being recorded. So if you're joining us via the recording here in a few weeks, in a few days, hello, we're glad that you're here as well. So let's get into it. We have 4 amazing campus partners here with us today, and I'm going to let them introduce themselves. So first, we have our colleagues in our Duke Student Health.
Hi, my name is Ellen Crawford, and I'm one of the nurses here at Duke Student Health.
Hello, I am Calvin Vini. I am the insurance care specialist here at the university at Duke Student Health.
Hello, my name is Deja. I am a Gallagher representative on campus. I am the Student Health Benefits Coordinator.
Next, we have our counseling and psychological services.
Hello, everyone. I'm Renee Evans. I'm interim director of CAPS and psychological. It's called CAPS, and it stands for Counseling and Psychological Services.
Then we have DuWell.
Hi, my name is Sarah Campbell, and I'm the associate director with DuWell.
And finally, DukeReach.
Hi, everyone. I'm Victoria Krebs. I'm an associate dean in the Dean of Students office in DukeReach.
Hey, everyone. I'm Amanda Roziski, and I'm an assistant dean and case manager in DukeReach.
Awesome. So we're going to spend some time this evening kind of diving into each of these offices and some of the resources that they provide. And so we're going to go ahead and get started with Duke Student Health.
Hello again. Glad you all could join us tonight. We're excited to have your students come to Duke. It's a great place. We're really here to help them be their best people academically and physically and emotionally and everything else. So just a little bit about student health. Please consider this your student's primary care office while they're here at Duke. We are fully staffed with physicians, nurse practitioners, dietitians. We have a full lab. We have PAs. We have an immunization clinic and a travel clinic. And there's a lot that your student can use here if need be. We are an appointment-only facility, so if your student does need to be seen, they can call and schedule an appointment. We try to get them in the same day if possible. If not, we see them as soon as we can, which is usually within the day or two. As I said, we do have 2 dietitians on staff, and they can be seen as well by appointment only. We have a full triage nurse line that is available to your students 24 hours a day. If they're not sure if they need to be seen, or if they have a question, or if they just want some advice on some home health, they can call that line and get some, speak to an RN, and they can kind of navigate whether or not they need to be seen by someone, or if they can just be given some home health advice. The very first thing about student health that your student has probably already seen or gotten emails and messages about is immunization compliance. And it is a state law that all students have to fulfill immunization requirements by the 30th day of class. So if they have not already done so, I really hope that they can quickly submit their immunization records. There is a full set of instructions on our website, which we will put the link in for you all. And I am very happy to answer any specific immunization questions that you may have later during this chat this hour. We also will be having a walk-in immunization clinic the middle of August after your students arrive, the end of August, excuse me, for any students who may still need some to meet some of the requirements. So again, we're excited to have them here, and welcome.
All right, so I am up next. I am again Renee Evans. I'm the Associate Director of Counseling and Psychological Services, also known as CAPS for short. Very excited to share a little bit with you about who we are and what we do. So we are a multidisciplinary approach office, which means that we consist of clinical mental health counselors, clinical social workers, psychologists, as well as psychiatrists. We have psychiatric residents who also work with us. They may be nurse practitioners, they may be psychiatry residents. We also have master's level clinicians as well as PhD level clinicians. And in the state of North Carolina, the master's degree is the expert degree at the social work and clinical counseling level. So if a student is seeing a social worker at a master's level or a PhD level, either one of those individuals is just as qualified to see the student. Sometimes there's some question about that. Students come in on a short-term counseling approach, and what that means is they may come in with varied emotional, social kinds of issues, and we have counselors available on site for your student to be able to see. They may choose to see the individual just 1 or 2 times, or it could be that they may see them longer. And what I mean by short-term counseling is sometimes young people come in, they want to talk to us and talk through an issue, they're good to go, and then they may move on. And then they may not come back in until they need to see us again, and that's okay as well. The way someone can come into CAPS is via walk-in services. So we have walk-in services on a daily basis. Let me make sure that I'm clear about what that consists of. Walk-in services allows a student to be able to get in to see a clinician through our assessment team that's known as TRAC, T-R-A-C. The assessment counselors are there and available. They're licensed clinicians as well. They are there and available to help your student identify what the issues are and the services that they may need mostly. And so they will give them some nuggets. They will hear what they have to say, give them some feedback, give them some nuggets to be able to manage and be able to cope during that particular day. And then if it looks like it's something that we can deal with in the counseling center, then we will actually refer them to a clinician. That means they will have an appointment scheduled before they leave, and then they are able to come back and see a counselor on a regular basis. Regular basis is typically every 2 weeks. Sometimes it's once a month. That is all contingent upon the agreement by the clinician as well as by the student. Sometimes young people come into our office and it's something pretty significant that we're not able to address in the clinic. Reason being, we are not a treatment facility, meaning we're not a medical hospital. So we may have a young person coming in and they may be having significant psychological issues that requires maybe more intense kinds of services. In that case, that's no worries as well. We're here and available to assist them with the next steps to be able to get the services that they need. As it relates to psychiatric services, if students are seeing someone already, for example, if they're taking medications and maybe seeing a psychiatrist already, maybe back at home or in the local community, then we like to make sure that they continue with that provider. We will not allow them to be able to see a provider here as well as a provider there. It's just really best practice, and we want to make sure that the medical doctors are not stepping over each other's toes, and we want to make sure they get the absolute best services possible. There will be a link provided in order to provide additional information about CAPS and how students can get in to see us. Thank you so much.
Hi there, I'm Sarah Campbell. I'm the Associate Director with DuWell, and I am so excited to share with you today about DuWell and what we do here at Duke. DuWell is the programming and outreach arm of the Student Wellness Center. So we focus on a holistic approach to wellness, and our work at DuWell falls into three primary areas: risk mitigation, wellness promotion, wellness development, and service. So risk management, really teaching students how to manage risk around choices that they may make. Some of that might be within relationships, but also with substance use. Obviously, policy and our recommendations as students who are underage that they don't engage in substance use or drinking. But we also know students make their own choices. So we work to teach them how to understand signs of alcohol, what's happening in their system, and how to do that in a safe way should they make that choice. The second area, wellness promotion. We do a lot of programs across our campus to help students build wellness practices and wellness engagement with those wellness practices. The top two things that impact students on a wellness basis pretty consistently is stress and anxiety. So a lot of our programs are trying to help students to gain more tools to manage that stress and lower their anxiety. And those programs are under the umbrella name of Moments of Mindfulness. These are programs that are weekly. They're offered on a consistent schedule, and they're programs such as meditation, yoga, drum circle, painting, tea ceremony, knitting, you name it. Like, those are just a few that we do. And they're very action-oriented, experiential, creative, and we try to give students the opportunities to really use their hands and be in the present moment and allow them to socialize with other people. All of our programs are in the Student Wellness Center, and there's no registration or fee required, so students can just show up. And we also have mindfulness workshops, breath work, somatic awareness programming, group health coaching, and other group workshops that students can register for. Most of these programs are student-led, which goes into our next area, which is service. So we have student interns, our student wellness interns, who teach students these wellness activities. These student leaders have figured out what wellness is for them and what practices they enjoy, the things that drive them in their own passion and help them to mitigate their stress. And so they pass those on to other students. In the Wellness Center on West Campus and in Bell Tower Dorm on East Campus, all students have access to the Oasis space, which is a place where they can relax and recharge and re-energize. There's massage chairs, aromatherapy stations, and other resources to help them just get away from the stressors and take a moment to relax. We have a wellness newsletter that goes out on a weekly basis, our Wellness Wednesday newsletter. There should be a link to sign up for that. You can sign up for that too as a parent. And it will tell us about all of the wellness events that are on campus, not just within DuWell, but our colleagues across campus. So all different avenues for them to really try to develop a consistent wellness practice. I think I hit all the major points, but if you have any questions, feel free to drop it in the Q&A and I'd be happy to answer them.
Hey everyone, this is Amanda Roziski here with DukeReach. I just wanted to provide a brief overview and I'm happy to answer any questions. So our office provides non-clinical case management services. So that includes things like advocacy, intervention, referrals, and follow-up services for students who are experiencing significant challenges related to mental health, physical health, social adjustment, or anything else. Basically, students can reach out to us themselves. Sometimes we hear from parents and families or a student's friend or a professor. Basically, if somebody is caring about you and is worried about you, they might reach out to us. And if you're experiencing anything that you're needing help with, you can reach out to us directly. And the best way to get a hold of us is to submit a DukeReach report, which is if you Google DukeReach, I see it's in the chat, but just for the future, if you're wondering who should I reach out to, if you Google DukeReach, will pop up and we will get you connected. We often refer people to everybody on this call here and other great departments all over campus. I did see a question about speaking with parents. We can receive information from parents, but due to FERPA, we don't share personal information about students with parents. There is a release through our office specifically if a student is interested in that. But again, we can receive information from parents and we'll reach out to your student to help them. And sometimes that might be a quick meeting if it's a quick referral, or there might be a more complicated issue with lots of referrals, and we might follow up with that student for weeks or months just to make sure that they are getting the support that they need. And I think that's pretty much it. Victoria, do you have anything else to add?
Yeah, that sounds great.
Okay.
All right. So we are going to move on to our question portion of the evening. So if you have questions, like we said, feel free to put them in the Q&A and we will go ahead and dive into some of these. So a few questions about the pharmacy on campus. Can anyone kind of speak to Duke's pharmacy? Is it open this summer? How can parents get questions answered?
Yeah,
I can answer that one.
question.
Oh,
Oh, Calvin, sorry.
Ellen, you first.
We do have a pharmacy on campus. It is located on the first floor of the wellness building. They are open this summer, so they would be happy to answer any questions that you have. They are typically open during the day. I believe they close around 5 o'clock. I can get a phone number for you and we can drop that in the chat, and that way you can call with any specific questions. But if you do have some prescriptions from home that need to be transferred, that would be the best thing to do, is to go ahead and give them a call and see how to get that process started.
And I think they're open till 5:30, Ellen, sorry.
Perfect, thank you.
And for any international students, please make sure that you at least get a month's worth of supplies for any prescriptions as well.
Cool. Can anyone talk about the process of if a student or a family is unsure if their own health insurance will suffice the health insurance requirement that Duke has?
Okay, I'll take this one. Again, my name is Deja. I'm the Gallagher Student Health Coordinator on site here at Duke. So for waiver criteria, if you go onto the Gallagher portal, there is a PDF of frequently asked questions. And if you go to page 4 or 5, it'll list the waiver criteria there. You'll be able to also log in and put in your insurance information. And I think within 24 hours or less, you'll get a response back explaining. If it is denied, you'll get an explanation on why. And if it's approved, you'll get the email as well. And if you have any questions, you can always reach out to myself and I can always look into it in more depth. And I can put my information into the chat as well.
So Amanda, you mentioned this, but I think we can maybe broaden it even a little bit more. For family members who are wanting to get some information, maybe, but feeling a little stuck with FERPA or HIPAA, we mentioned some forms. So how can families stay connected to their students' health?
So for our office in particular, that would be a request that would come from the student, and we would share that form directly with the student who would share it with their parent and family member or a provider.
Awesome. How frequent can a student get a same-day sick appointment, like if they're sick in the student health center?
We try very hard to see the students who need to be seen the same day. We do set aside a chunk of our schedule just for that very reason. Now, unfortunately, a lot of times the students sleep in and they call at 4 o'clock looking for an appointment, and that might be tough. But we do try very hard to see them the same day. We do close during the school year. Our last appointment is at 4:30. So if students do need to be seen after that time or on the weekend, because we are only open Monday through Friday, there are several urgent cares right around Duke's campus that will be available to them. And of course, in an extreme emergency, we would certainly direct them to the Duke ED.
Yes, so there's definitely a question around what happens if my student needs aftercare service when student health is closed.
And
So-
again, I would encourage them to use our triage line, because there is someone who answers that phone 24 hours a day. And that staff is kind of trained to, to help the student if it's something that they would need to be seen for immediately, or to kind of get them through the night and have them call us back for an appointment in the morning. So we do have plenty of resources, after our resources. We just are not open after the 5 o'clock hour.
Thanks, Ellen. What about students with potential allergies, especially food allergies? Is there a process? How can we make sure that folks know?
Well, one of the great things that our nutrition department, our food services department has done here is set up an allergy program. And there are resources in all of the student facilities where they eat, all of the dining halls, where students can speak directly or have their questions answered about any allergies that are taking place at that food service. Other than that, if you would like to come in and have that on record, I would encourage the student to, if it's an allergy that's going to need, EpiPens and that type of thing, have them set up an appointment with us when they get here at Student Health.
Great. So if a student's separate insurance from Duke is approved, what sort of material do they need to bring? Is that kept on a file somewhere?
They would need to bring their insurance information with them. So if they submitted an insurance waiver request and the waiver is granted, they just, whenever they come in for any medical services, whether it be a student health, Duke Hospital, urgent care, or any contracted Duke provider, to make sure that they have their insurance card, or at least a picture of it on their cell phone of their insurance information for processing.
And what about if a student has the Duke health insurance? What do they need to provide?
It's no different whether it's this Duke student insurance or if it's their own private insurance. If they have the Duke insurance, that's better, because once we put it into the system, it's in the system. We still put private insurance information in the system, but they may require to see it. Compared to a Duke student insurance, it's easier for us to get access to the insurance information if it's the student insurance compared to private insurance.
And Calvin, I fear this might be another one for you, but does the Duke health insurance cover vision and dental services?
Medical and vision let me rephrase that. Medical and vision have coverages through the student insurance policy. Dental is separate. We do have a great dental plan through Aetna. It's a one-time charge of $329, but they're given a $2,000 budget that they can use at any dental facility that accepts the Aetna dental plan. So there's nothing that should come out of the student's pocket. It should come out of that budget. So the only time the student would have to pay out of pocket, or should have to pay out of pocket, is if the budget reaches zero.
And there is also, this is Deja, there is also a on-site dental campus smiles. So if students want to be seen on the campus, they can. It's also in the Wellness Center on the first floor. I highly recommend schedule an appointment in advance because they do book up fairly quickly. And so, yeah.
Renee, there's a question about, does CAPS provide a service to help connect students to therapists in the local area?
Yes, we definitely do. Students can still come in and go through our track service. Track will assess the situation, determine what their needs are, and we can definitely help get them referred to someone in the community. Absolutely.
And what about folks who are still maybe waiting to hear if their health insurance is going to be approved to be waived? Should they have heard by now, or what can the timeline be?
Usually it's a 24-hour turnaround time. If it's longer than that, I mean, I don't think it'd be more than 3 days, but usually it's just an pending review and you'll get a response fairly quickly. But if you are experiencing a longer time, please reach out. You can. Again, I've provided my email and phone number as well if you are still in like a pending review status. Some insurance plans are manually reviewed, and then that's when I will come into the picture and manually review them and see if it can be an acceptable insurance. And I also want to add that the student health plan also covers international as well. So GL Blue is a part of the student health plan. So if you do decide to travel abroad during the fall or spring, you are covered for emergencies while out of the country.
So if a student is entering with a medical health condition, who should they let know? Is there a process for that?
Any medical provider that they're going to see, they should let know that they have a pre-existing medical condition to have the continuity of care.
And I would say if they want to establish care here with one of our providers while they're here on campus, once they get here and get settled, I would have them just call and schedule an appointment with one of our providers at Student Health. And again, we have physicians, nurse practitioners, and PAs, and they can just, come in and be seen to establish that care, and then they could discuss their needs at that time.
And does the Duke medical insurance cover for the calendar year or the academic year?
It's always for the school benefit year. The school benefit year always runs August 1st through July 31st. That's with any college. So that's how long that the school benefit year goes to. So August 1st through July 31st.
And where is the health center located? Is it on East Campus? Where can students find help?
We are located on West Campus, 2 buildings behind the Bryan Center, or on Tower View Road.
We got a few questions about like immunizations in the sense of COVID or flu tests. Are those things that are provided through the Student Health Center?
So the flu vaccine is not mandatory for students. I did see a question for that. It is mandatory for health science students, meaning the professional students, med students, PT, PA. It is highly recommended that all of our students get the flu vaccine, and there will be clinics all over campus. If you want one, you'll be able to get one. We have a great program here where the clinics are set up all over campus in the fall, and they can just have a walk-in to receive those, or they can schedule an appointment to get the flu vaccine. We do carry the COVID vaccine. We're presently on pause with that right now. We're waiting until we can get the updated version that we're expecting sometime this fall, but we will have that updated COVID version available when it is made public. And as far as just general immunizations that they may need, We do have an immunization clinic here for things that even are not mandatory, such as the HPV vaccine, meningitis B, that type of thing. And I think one more question you had was about testing. And yes, if students are not feeling well, we do have a process in place here where they can come in and get flu tests and COVID tests.
So we have a question just wanting to know a little bit more information about if a student is in an emergency situation, how does Duke help? And then if there's any sort of process of communicating or notifying parents.
Well, typically, from a medical point of view, I won't speak from CAPS, but from a medical point of view, if the parents want to have access to their students' records or information, there is a form on our website that the student would need to sign to release medical, to give the parent permission to have access to the medical information. That form can be a little bit tricky on the website. If you can't find it, I would encourage you just to call us and we can walk you through that. As far as emergencies go, typically the students that come here at Student Health are not dealing with real acute emergencies. If a student comes here and we feel it is necessary for them to be transferred to the ED, we will do that. But typically, in the sense of a true emergency, they are going to the ED.
The best thing I always tell students that when you're deeming something an emergency, if you can't sit, walk, or stand without extreme pain to the point you're doubled over in tears, or someone had to call EMS because you passed out, there's profuse bleeding or projectile vomiting, those are considered normally to be emergency room, urgent care type situations. If it's just the sniffles, cold, flu, sinus, minor aches and pains, cuts and bruises, it is not deemed an emergency. Then, you may be sitting in the emergency room for 4 hours, where Student Health can get you in and out.
And from the perspective of CAPS, if there's a mental health emergency, typically we will involve Duke Regional. That's typically where we will send a lot of our students who are having mental health emergencies. And that mental health emergency can look a little bit different. So anything that impairs the student's ability to be able to function, be able to focus, be able to concentrate. Sometimes students are having psychological breaks and other things that significantly impair their daily functioning. We would do a thorough assessment of that and then make a recommendation to ensure that the student has the very best care they need. And again, that's typically at Duke Regional. If a student is under the age of 18, we're able to communicate with the parents on a general basis. If they are 18 or older, they do need to be able to sign a consent for release of information on a regular basis. In the event of an emergency, such as danger to self or others, in the event of there's certain things that we're able to, certain reasons, such as the emergencies, where we're able to then make sure we involve it. In this case, for CAPS, it would be whoever the emergency contact is for CAPS. So I want to be real careful with that. I was going to say parents, but it's whoever the student identifies as the emergency contact for us. And so let's say you call and if it's an emergency and you're the emergency contact, we will be able to communicate with you. If we don't have anyone down, then we will, definitely be able to communicate with you. Let's say it's a regular day. There may be distress going on with your young person and they're needing to get in to see someone. You may be calling because you just want to confirm that they came in. You just want to know whether or not we were able to get them some help in the community, unless we have a signed consent for release of information, also called a release of information, ROI, we will not be able to communicate with you. And that is state law. That is something that protects the student. It's not us trying to be negative or mean in any kind of way. We'll do our very best to try to assist as best as possible, even with giving general overview information. But information in CAPS is considered confidential. So we do try our very best to protect the students' rights with that and make sure they have what they need. We can definitely try to connect you with the resources on campus if you have it. Don't worry, we won't leave you necessarily out there to dry. We don't want you to think that at all, but we do have some good pieces in place to make sure we can support your student.
Awesome. Sarah, there's a question about where some of the mindfulness activities are held, and if you could review a few of them again for us.
Yes, so we offer wellness programming on both East and West Campus. So we offer the programming in Bell Tower, which is our space on East Campus. Students do have access to that even if they don't live in Bell Tower, and during a certain time of the day. And then we offer a lot of our programming on West Campus as well. And then we do have student groups and other organizations who offer or who request programs that could potentially happen within the dorms or other spaces on campus as well.
Awesome. Is there a way to transfer prescriptions to Duke Pharmacy?
Yes, I would call the pharmacy number, the Duke Pharmacy number, and ask them the process for that.
All right. So there's a just, I guess this is a pretty logistical question, but helpful nonetheless, of thinking about a student that has their own health insurance. Could that mean that there is a fee when they come to the student health center to be seen?
Yes, they have to pay us for services. No, I'm kidding. No, if they have their own insurance, that doesn't prevent them from being seen at Duke Student Health. On the student's bursar statement, they'll see a line item that says health fee. Each student or all students that are on campus or around the campus area are charged that health fee. The health fee allows them access to CAPS, DuWell, DukeReach, and Student Health. The health fee is in essence a semester-long copay that's already prepaid, where the student can be seen at these particular facilities or with the providers pretty much anytime they want, at least for the semester, I should say. So if they wanted to come every day and say, hey, I just decided I want to come here because I paid for it, then by all means, you do what you need to do. That has no bearing on the insurance, by the way. So let me just clear that up. So Duke Student Health only charges the insurance for labs, immunizations, vaccines, travel vaccines, and x-rays. If it's not any of those services, then there's no charge to the insurance. So cold, flu, sinus, minor aches and pains, cuts and bruises, the ask the provider questions, there's no charge to the insurance for those services.
So we're getting a few questions about physical therapy. Is that something that Duke Health provides?
Yes, I'm sorry I did not mention that earlier. I'm glad somebody asked that question. We have a physical therapy department on the 3rd floor. I don't know much about it, I will be honest, but we do have physical therapists on site and an office here on site. Sometimes you need a referral to get there, and if that's the case, you can call Student Health, but I believe that you can set things up with them directly.
Just to piggyback off Ellen, the PT/OT office that's inside of student wellness is a hospital-based service. So co-pays do apply. That is not covered under your health fee. So your insurance will be billed for any services that are done in the PT area.
Along the same lines, what is the process if a student needs to see a specialist, an allergist, an ENT, those pieces?
Students need to come here to get a referral first. So they would need to set up an appointment and be seen at Student Health by one of our providers, who will then make the referral. We do have a referral department here that works with the student and works with their schedule and with the offices where they're trying to be referred, and they do help them set up those appointments based on both of their schedules.
Will students get a proof of insurance from Duke?
Do you mean like a
Yes.
physical card? Yes. If they're referring to like a physical card, then yes, they'll receive it in the mail. Always, I would check to make sure whatever address you have in your Duke Hub is the address that we Gallagher have and Blue Cross Blue Shield has. So that is where it'll be sent to. You can always update your address and request for a card to be mailed to you on campus. But that is up to you if you would like to do that. And also another thing, I can also print you off a copy as well if ever needed, if you do decide to go with the student health plan.
All right. How do students pay for prescriptions? Is there a standard charge? Does it depend on the medication? Does it depend on insurance?
That kind of a tricky question. So are we talking about private insurance or student insurance?
I'm
So
not sure.
if it's through private insurance or through student insurance, it normally falls under a tier system. So there's different tier levels based on the medication that is required. Because of course, depending on what the medical services or the medical condition is that requires the medication will be based off of the different tier systems. So I'll give you just in general, we'll say for scenario sake, if you need an antibiotic because you had a infection from a cut, that would normally fall under like a tier 1, which is $0 to $4. I think for the student plan, I can't speak for any other insurance plan without seeing their tier setup. But something like a cancer treatment drug or something may fall under tier 5. So it won't fall under the same tier. So it depends on what the medical situation is and where it falls in the tier system. I know it's a little tricky, but it would basically be, that's more of a pharmacy related question to see where, based on the medical condition, what tier level it falls under.
So maybe it'd be best to call the pharmacy for more details. Great. Are there like women health services provided, including birth control?
Yes, there are women health. Yes, they can have any of their women's health needs taken care of here, and birth control, STI testing, general pap smears, and that type of thing.
A lot of questions about when we can expect to receive the insurance cards.
Well, if you've already enrolled, you should be receiving it before August 1st. It does take roughly around 2 to 3 weeks to receive your card. So the sooner you enroll, the faster you'll get your card. If you haven't taken any action to enroll, please do so you can receive your card.
DukeReach, can you talk about the process if a family member is wanting some support for their student? How would they go about getting that?
Yes, sorry, I was just choking on water. If a parent is worried about their child, they could submit that report through DukeReach, and just be sure to give us your email address or your phone number, and we will call you, email you, however you prefer to communicate, Zoom with you, and hear more about your concern for your student, and then we will move forward to connect with the student.
So when a student requests or schedules an appointment with student health, can they request a particular provider?
They can. And then based on the availability and the schedule, we'll do our best to grant that. But yes, they can request a specific provider.
And then for billing, for particular maybe copays or coinsurance or services, are those attached to like bills? Are they going to the parents, students? How could they go about finding that?
if the student is under mom and dad's insurance or a legal spouse or legal guardian, then of course, if they're the dependent on that, then the billing statement is going to go to whoever the policyholder is.
Wonderful. I want to draw your attention to the chat as well. Shanice has been putting wonderful links in there to our partners' websites, some phone numbers, things like that too. We have some emails. So there might be some helpful information to answer some questions that you may have in the chat as well, just so you can see those. And I think at this point, our questions are either being answered or have been answered. And so I think we'll just go ahead and let, if there's one final piece of resource or advice or help from each of our partners, I'll go ahead and open up the floor to round us out for this evening.
I would just like to say that I would highly encourage you to encourage your students to read their email. I know they don't like to do this. I have my own children, so I understand. But we at Student Health do send a lot of very important messages through email, especially this time of year regarding the compliance piece for the immunization process. Because per state law, if they have not fulfilled the requirement by the 30th day of class, they will be removed from class. And this does happen every year. We don't want it to happen to your student. So we have already been sending emails out to those students who have not met the requirements yet. So I would highly encourage them to check their Duke email address. And I know that can be sometimes not on their radar during the summer, during transitioning from high school or wherever they're coming from into Duke. So I would just highly encourage them to check their email and to be, feel free to reach out to us with any questions.
So to piggyback off Ellen, because me and Ellen normally go through this when we go to orientations. Like she said, please read your Duke email. We can tell when you've opened the email and all the emails are date and timestamp down to the second. The worst thing you can do is tell us you didn't get the email. So we can tell when you've gotten the email. We can tell if you open the email. So the best thing you can do is just be upfront and honest, and then just make sure you check your email to make sure you don't miss any important dates, because Ellen doesn't like to be the bad guy, but she has rules that she has to follow. The bursars don't like to be bad guys, but they will put blocks on your account if you are not doing or following through with your emails or are missing charges and things like that. They will put blocks on your account. We can't have them removed. That has to be removed for the block from the Duke Bursar's office. So like I said, and like Ellen said, please read your Duke email, go through your Duke email account at least once a day, just to make sure you're not missing anything that's important.
And to piggyback off of Calvin, again, please check your emails. Also in the portal, the Gallagher portal, you can also put an alternative email, and you can put your parents or the family email there. So you both are able to get notifications. And again, like Calvin was saying, it is timestamp. I can see when you log in from down to the second. So I'm able to see everything on that side. So yeah, just please look in your emails. And again, if you have any questions, feel free to reach out to Calvin and I.
I think
Just one more thing. There are also very informative videos on the student health site. I know insurance can be very boring and very challenging at times because it's something that, as students, you probably don't really pay attention to. Your parents are taking care of things, but there are also very informative videos learning about what deductible, co-insurance, and what you should probably do before you get on campus, like making sure you have, again, a month's supply of prescriptions, because you're going to be so busy probably the first month just getting acclimated to the campus. So I just highly recommend to also utilize those videos and just take it. Again, they're just like maybe a minute and 30 seconds. So take your time, look into it, and it's very helpful. Sorry about that, Sarah.
Yeah, from our office, I would really encourage your students to do the wellness modules. Those just rolled out on Monday. And students are supposed to complete 2 wellness modules. One of them is more of an educational way of trying to enhance wellness and reduce risk. And then that will flow into creating their own wellness plan. And so we're really trying to get your student to think about the ways in which they cope with stress. Maybe it's very great ways, maybe it's ways that they could, things that they could improve on. So that second part of the module will allow them to build a wellness plan so that they can walk onto campus with Duke with all the resources that we offer here, not just within our office, but across campus to help support their wellness. So that's a big piece of advice.
I will say, if you're worried about a student and you're not sure where to start, DukeReach is a great place to begin, and we will get students connected. Also, another little tip that I like to tell families and students directly is to save the Duke University Police Department phone number in your phone. I'm an iPhone user, so I have it like in my favorites. But just a quick way, just in case there's an urgent need, you have that number quickly. They're right on campus. Just an easy way to get to them.
Wonderful. Thank you all so much for going in such depth about wellness at Duke. And thank you, families, for being here with us tonight. We have 2 upcoming webinars for you to put on the books. So Thursday, July 25th, we're talking about campus life and student engagement. So all ways that your students can get involved on campus and find their passions. And then Wednesday the 31st, we're talking about student safety with security and support in the Duke community. So it's like Amanda knew that, Duke Police is gonna share that number and be there. So thank you all so much. If you have follow-up questions, please feel free to email us, email anyone else on the screen. We're happy to get you connected. And thank you and have a fabulous evening.